Lachapelle.
Hi, I'm Bridgette VanFossen, and this is the Dominion Women's Health Podcast, the Med Spa edition. We talked briefly in our last episode about microneedling, so we're going to go ahead and demonstrate that for you today. This is our lovely model. She's going to hang out with us today. She's already been numbing for about 45 minutes, so that way it helps keep it to a very minimal pain, but we're just going to kind of walk you through the whole process.
All right, let's get started. All right, so first Bridgette is going to apply some lift serum, which basically is like some nice hyaluronic acid. So we're going to start on the forehead here. I'm going to do like a quick little pass and kind of just check in and see how she's feeling, like if there's any discomfort at all, but she's been numbing for a good minute, so it should be okay. And we're going to start at a depth of 0.5. All right, so I'm starting the pen here. All right, so I'm going to do a quick little pass here.
And with each area, we typically do about 3 passes. So it's a horizontal, vertical, and then circles, and that's 1 pass. So we're looking for a nice even erythema, which is just a nice redness. Pinpoint bleeding is to be expected, so you might leave your appointment looking a little red, a little bloody. That's totally to be expected. Those are what we want to look. That's going to give us the nice results. And this little lifting helps us give it that glide because we don't want the needles to just kind of across the surface. It helps make a nice smooth pulling motion, so that way it doesn't cause any stretches.
Okay, perfect. Does that feel okay? Do you think you can handle a little bit deeper?
Yeah.
Okay. Awesome. All right, so I always check in with the client and see if they can handle going a little bit deeper. We go up by 0.25, so we're at 0.75 here. And I'm just going to do 2 passes on her today because it's her first time. And if their brows aren't microbladed, I go pretty much into the brow just because why not?
It can help stimulate hair growth, so people with patchy brows, this is a really good thing. But if there is a tattoo on there, we obviously want to avoid that because we don't want to get rid of that pigment. So my brows are microbladed. I always keep a nice like little surface on top of it so that way we don't go too far into them. So it can even go up into that hairline for the same purpose. So if you feel like your hairline is starting to go back a little bit and you're getting microneedled, your esthetician can always go up into that hairline to kind of help stimulate the hair growth. Looking nice and pink.
Perfect. All right, if you want to lift up real quick just so the camera can see, here on the forehead, that's what we're looking for, just like some even erythema or redness, and then some like minor pinpoint bleeding, just those dots of blood there. That's how we know that we've gotten to where the collagen is and really have started that. Exactly. Perfect. Yeah, so I'm going to have you turn a little bit this way. Awesome. And basically after this, all she'll really feel is like she had like a mild sunburn, if that. A lot of people feel very mild discomfort with after. Okay. Whenever I'm starting a new area, I always go back down to usually a 0.5. Beautiful. Thank you, Bridgette.
Of course.
Okay.
And that's really one of the big beauties about skin pin microneedling, like we touched on the last episode. It's a very minimal downtime for your healing. Like Alex said, you're going to have a mild discomfort probably the following day after all the numbing's worn off. We always akin it to feeling like a light sunburn. So you're going to feel nice and tight and dry, but we, again, don't want to do anything for the first 24 hours while those microchannels are open. So we keep it, hands off the face, nice clean pillowcase. So that way we don't add any sort of infection into those open microchannels. And then we keep it a very nice hydrating first 5 days after that. So that way we can make sure everything's staying nice and plump, we're healing correctly. And if we were to add in PRP to this, that's going to help accelerate your healing. And that's a really fun thing. Like we talked about before, it's just your platelet-rich plasma, it's your own blood, so it's your own growth factor serum because it's your own DNA. So that helps speed along the process as well. But then after 5 days, you can go back to your normal skincare routine, whether you're using, your AHH and your chemicals and all of that. But again, that first 5 days, nice and hydrated, but you won't be super red or pink after that, which is really nice.
Okay, how did that feel?
Good.
Okay, awesome. I'm gonna move it up a little bit more just because I think her skin can handle it.
And like we discussed before, we, can go all the way up to a 2 milliliter depth. So what we're looking for again would be go up in that 0.25 increments, just that way we're not doing too much and not getting too aggressive with it. So this is what Alex is doing. She's kind of checking in to see how the skin's responding to the needles and seeing if, if it is pinking up, then we stay at that depth. But if it's not pinking up and we still want to see a little bit more, then we can start to slowly increase it all the way up to that 2 milliliters. And it's going to be different for everyone. I know my first time I was able to go up to like a 1.75 on my cheeks, but Alex was, I think, at like a 1.25. So it's different for everyone and kind of your skin depth and what you can handle. So your whole skin pin in microneedling is customized to you.
I might actually do a third pass just on her cheeks, just because some redness is coming up, but I want to see a little bit more and some pinpoint bleeding. Yeah, thank you.
Of course.
Awesome.
There you go.
Thank you, Bunker. All right. And how we determine like passes and everything, depending on the area, we usually go like vertical all the way through the area, then horizontal. And then for that last one, just do circles throughout the whole area that we just treated. And that's considered one pass.
Doing okay?
Mm-hmm. Perfect. Definitely starting to see more pink. And the maximum amount of passes you want to do is 3. Okay. And for this last pass, I'm ending at 1 millimeter, so that's actually what Bridgette's going to start at the left cheek, is 1 millimeter. Okay. Beautiful. All right, so I'm going to do the under eyes and the nose. So under eyes, we always do at a 0.25, just because it's a very thin area, and there's no reason to go any deeper. Nose is at a 0.5, but both of these areas you only do one pass at just because of the area.
Have you looked up really fast and go underneath your eyes?
Perfect. And for the under eye specifically, you always want to pull down that skin right there to the orbital ridge, like that bone right there, just because, you don't want to be going on underwear that doesn't have bone underneath. So, but a lot of people, like myself, I struggle with like dark circles under my eyes or just like those fine lines, like dehydration. It's definitely, I feel like, an underlooked area. It's definitely hard to treat a lot of the times, but this is a great service to kind of tackle any of those concerns right there. All right. Perfect. So I'm going to go ahead and pull that down.
And not only just with dark under circles, a lot of people suffer with milia, which is a lot of congested, depending on if you're using the wrong kind of eye cream or you're taking your regular face products too far in your eye area, it can congest that area and become like these hard little round spots, which is not fun to deal with. And it is easy to extract in the room, but a lot of people will try to mess with it at home, which we don't want you to do. So this can help really bring it to the surface and break up all of that, so that way it clears the area. Same with the nose with the sebaceous filaments. This is a really great treatment to kind of help bring everything to the surface and clear it out, so that way all of that congestion can go away and look a lot clearer.
Okay, and remember for the nose here, it could be a little bit
ticklish.
Ticklish, yes, thank you. Because the sinuses and everything, so I try to go quick, but I take little breaks. You let me know if you have to like sneeze or anything.
Okay.
Okay, so then move it back up to a 0.5. Okay, let's start right over here.
I sneeze every time I have to do this part, so.
You're doing great. Beautiful. That is one side. Have you look a bit towards me? Okay. Awesome. I'm just going to do, I know, right? You are doing great. I know. Sometimes we save it for last, so I'm like, let's just make that the last thing. But, all right, so let's start right up here. Good job, good job. Okay, awesome, awesome. We go for that. This is also great for those 11s that a lot of people get. Great alternative to Botox. I'm going to give this out one more time.
Because again, what this microneedling is doing, like we talked about in last episode, is we're helping stimulate the collagen elastin production, so that way your skin starts to become plump again, you kind of lift everything, we're not like super saggy. So this is great, especially as we get older, those kind of deplete and go down.
Yeah, that's right. Switch? Yes, it is time to switch. Actually, I don't know why I'm moving. I don't know.
You ended at 7.75 here, right? Perfect. All right, and so we want to keep it nice and even. So I'll do the same thing on this, and then start at a 1 for her left cheek, and then chin is half of that.
All right.
You ready? Nice and gentle.
Forehead could definitely be a more sensitive area because it doesn't have a lot of that fat that we have, like, you know, let's say in our cheek area. But if people can handle at least 2 passes, they see really, really good results. And it takes about, obviously, 4 to 6 weeks to see those results. Just with, like, skin cell turnover and everything, it takes a minute for those cells that we just kind of created, like that collagen, to come up to the surface. But usually for, you know, people with acne scars, the fine lines and wrinkles, they start to see really good results just after 1 treatment, but recommended 3 to achieve maximum results. And they last about 6 months, sometimes more, depending on the person.
This, of course, is really greatly paired with a good at-home skin regimen. And, of course, our favorite thing to talk about, sunscreen.
SPF. So for sunscreen, basically what a lot of people say is the best sunscreen for you to have is the one that you're going to wear every day. But with that being said, a sunscreen of at least 30, preferably 50, so I'm just going to put some lift right here, is going to be really good. Also, we want it to be broad spectrum, which means it's protecting against UVA and UVB rays. So think for UVA, A for aging, like those fine lines and stuff, and then UVB, B for burning, like sunburn. So we want it to protect against both of those. Okay.
And typically a physical sunscreen is going to be best versus a chemical. But your esthetician can always talk to you about kind of brands that work under those. Because we don't want to absorb any more heat into the skin because that can cause inflammation. And we're already doing enough inflammation as it is.
Yes. I know a lot of skincare concerns that people come in with are typically caused by inflammation, but sometimes to treat said concern, we have to cause inflammation to the skin. But while it's healing, we really want to minimize that as much as possible. So we typically tell people, like especially avid people who like to go to the gym and work out, wait at least, 3 days, or typically when you see like the skin's kind of calmed down a little bit before, because we don't want to, set that back at all, that process of healing. Looks like she's doing good.
You feeling okay?
Good. And there's a few different types of, considered microneedling. So first is nano microneedling. So that basically is the same process, using the pen, but instead of the stainless steel tips, you're going to use silicone heads, and you're only going to go down to a 0.25. It's, very, non-invasive really. It's, there's no downtime. You don't need to numb at all. It's basically just to help those serums that you're putting on the face penetrate up to 97% deeper. It's great to pair with dermaplaning, and it's really good for before a big event, like going to a wedding or just going out. Yes. And you can do it weekly, actually, for nano kneading specifically, because it doesn't go that deep at all. Chin, yes. And we typically do the chin half the depth of what we finished the left cheek at. Beautiful. Okay. Actually, what did we finish the left cheek at?
Left cheek was at 1, so we're doing a 0.5.
Perfect. Which is very typical for someone who's doing it the first time. We definitely notice after people have done even their first treatment, the next time their skin just has become a little bit thicker, which is really good. So it can withstand the pen going a little bit deeper, which is really, really good, because that means we're repairing that skin barrier and just making the skin healthier overall. Looks good. A lot of women definitely want us to focus on certain areas, like I said, the 11s, typical, laugh lines, smile lines, crow's feet. It's definitely really, really good. And I tell women definitely after the 3 treatments of the skin pen is when you can then go to your cosmetic injector and be like, okay, like I would like to do some Botox for the areas that, just for a little bit deeper. Yeah, exactly. And that way, you won't need as much Botox because we're doing like remodeling the skin from within, which is what I really, really like about this treatment.
Right. We're going to end with the upper lip for the face. We're going to do a 0.25. This is the part that's really ticklish for a lot of people because we're right on top of the teeth. So this is, between that and the nose is typically where a lot of people will have their most discomfort, but honestly it's still very painless. You ready?
Mm-hmm.
Awesome.
But thankfully it's a very small area, very quick.
Let's break it in half for you. One side.
And again, this is a great time of year to do this treatment, although it is recommended, for year round for really anyone who needs it. Just trying to stay out of the sun during the winter is, a lot easier.
One more time.
And again, you can go up to 3 passes, just not on the nose or under the eyes. Basically, until we see that redness, some pinpoint bleeding, that's how we know we got where we want it to be. Awesome. Beautiful.
How'd that feel?
Good.
Good? See?
Great.
Nice and easy, able to get through.
Exactly. Okay, so here, I will take that, give that back to you. I'm going to start just removing some of that numbing cream. Okay. Perfect. Thank you. I usually like to let it sit on there for 30, 45 minutes, hour. Depends on the person, but awesome. And ours is a compounded benzocaine, lidocaine, tetracaine, so as long as no one has an allergy to that, we are all good. All right, so I got that numbing off. Now I'm just going to degrease. Thank you.
Smelling part again. We want to make sure there's no oils on the skin, which is why we degrease. We did it for the face before camera, so that's why you didn't see this part. But this is just to help make sure that we have everything nice and clean, again, so there's no drag, and that little bit of slip from the lip itself just adds all that we need. So we don't want any extra oils mixing with it.
Awesome.
Cool.
Perfect. Okay. I would always start the neck at 8.5, but again, we can go up if needed.
This is, again, really great for treating those tech lines.
Yep. Perfect.
Especially since nowadays we're all like this on our phones, so it helps kind of really make sure that we're targeting all of that area.
And I think everyone kind of has their own method for how they do like certain parts of the face. Like we typically start with the right cheek because that's the side of the face that doesn't get the sun exposure. So that's going to give us more of an idea of how the skin actually is. Today we started with the forehead, but that's totally fine. It really just depends on where you want to start at.
And where you're most comfortable.
You can see her neck is doing very well.
And the great thing about the skin pin, it's been cleared for all skin types, so whether you're super pasty white or you are the darkest of the skin colors, this is going to work for everyone. It won't cause hypopigmentation, which is always typically a concern for the darker skin type, so this is great for everybody. Only people that we typically wouldn't recommend doing it is anyone that is kind of dealing with any sort of infection, because we want your body to be able to focus on healing. So if it's healing something else in the body, then it's not going to heal your face quite as properly. So people who have a compromised immune system, autoimmune disorders, typically anything along that lines is typically, we're going to go on the side of saying probably not a good idea until we can get everything else under control. Which that would be a conversation you have with your doctor. Your doctor would then need to clear you before going forward.
Yes, and like pregnant nursing, anything like that. Unfortunately, with pregnancy, there's not a lot we can do, but we can always, you know, still like dermaplane. We can definitely do a nano needling facial, which is really relaxing, you know, non-invasive. Obviously, we can't do medical microneedling while you're pregnant or nursing, but nano is a very, very good option to just maintain those results.
Still feeling okay?
Mm-hmm. Awesome. Okay. And this is our last pass on here. Got some even pink.
Start applying that pizza.
Good job. All right, and typically we would take some before and after pictures, especially if they're doing a series of 3, because seeing those results are really, really nice. And I'm not sure if you already talked about this, but PRP is also a really, really good option. I personally love treating the neck. I think it's great, especially for someone like me with those check lines, for sure. You doing good? Mm-hmm. Okay. Also, we just have 1 pass left.
Mm-hmm.
And I went to a 0.75 for this side, the second one. Mm-hmm. And sometimes, a lot of the times, the face, like different sides of the face can handle different depths. So, you know, I wouldn't be too stressed about like, oh, my neck on this side was a 0.75, but you only did a 0.5 on this side. Sometimes that's just what the skin needs. Again, we're literally just going off of how the skin is reacting in the moment. So, but that's why we document. And usually after like a full face and neck treatment, there will still be some of this lift serum to take home, which is really good because we want you to basically just be applying this for the first 24 hours. It's going to keep the skin really hydrated, and like we said, it's going to feel maybe like a mild sunburn, so it'll kind of, you know, cool off the skin a little bit too, which is really necessary.
Did you hit it?
But you were all good.
Okay.
Beautiful.
What are your thoughts? How did you feel hearing that through that?
I did not hurt at all.
See?
Awesome.
Nice and easy.
Yeah.
Yay.
Awesome.
That's always a huge concern for people because, you know, you hear the word needle, you think it's painful. So we just wanted to show that it is really nice and easy. You can sit through and go back to work. Just don't hang out in the sun.
Yes. Yep. Definitely.
Yes.
Awesome.
Awesome.
Well, I
Thank
think,
you.
Of
Yes.
course. We're
Yeah.
really excited to see your glow later.
Definitely.
Of course. Awesome.
All right.
Well, thank you guys for hanging out with us today. We will catch you on the next one.
See you soon.
Bye.